Hello guys, welcome to my YouTube channel DNA Medical Nursing Classes. So today we are going to discuss about the cardiac cycle. So in cardiac cycle, what and all the things we have to learn means. So one is systole, diastole and the durations and what and all the events happening in cardiac cycle. One more thing guys, I'll try to teach in both English as well as Hindi. Hope you guys know both the languages. So first of all, what is cardiac cycle? So cardiac cycle means the coordinated activity which takes place in a single heartbeat is known as cardiac cycle. मतलब so in cardiac cycle we learn the activities which are taken place in a single heartbeat. Okay, there are two activities takes place in a single heartbeat. One is systole, another one is diastole. What is systole and what is diastole? First we should learn these two things. For example, you people think in mind that if you are getting the things, the systole means contraction and the diastole means relaxation. You should understand these two things. It means the contraction of heart. This is the relaxation of heart. Now the systole means the contraction of heart and the diastole means the relaxation of heart. So this is left ventricle, this is right ventricle, this is right atrium, this is left atrium. So in systole, the blood has been ejected from the ventricle. How means after the contraction of this left ventricle, the amount of blood which has been ejected from the ventricle through aorta. So what is diastole? So diastole means the relaxation of heart. In diastole, the blood has been filled inside the ventricle. So in diastole, the blood has been filled inside the ventricle. So once again I will tell, the systole means contraction and the diastole means relaxation. Systole means the contraction of the heart muscle that cause the ejection of blood from the left ventricle to the aorta. Okay, now we can go through diastole. So diastole means the relaxation of heart muscle. So that's what the amount of blood which has been filled inside the ventricles. So that is called as diastole. So now you just keep in mind the systole and the diastole means the contraction and the relaxation. In upcoming later 5 to 10 minutes we should learn some ventricular systole and ventricular diastole. Okay, so before going to the ventricular systole and ventricular diastole, we learn some durations like the normal cardiac cycle duration is 0.8 seconds. How it would be 0.8 seconds? Means the activity which takes in one beat, that is 0.8 second. How? The heart rate 60 divided by heart rate. How we should calculate the cardiac cycle duration is 60 divided by heart rate. For example, the heart rate is 72. This is the normal range. So this is normal cardiac cycle duration. Okay, now just now we learned. So when the heart rate is given, how to calculate the cardiac cycle. How means the 60 divided by the heart rate. The normal it will come around 0.62. 1 seconds. Okay. Now we should learn some durations of a cardiac cycle. So this is atrium, both above are atrium and both below are ventricles. Okay, so atrial systole and the atrial diastole, so ventricular systole, the ventricle diastole. So the normal duration of atrial systole and the normal duration of atrial diastole, so this is 0.1 seconds and this is 0.7 seconds, and ventricular systole is around like 0.3 seconds and ventricular diastole is 0.4 seconds, 0.5 seconds. So the total 0.8 seconds. I told you previously what is systole and what is diastole. The systole means the contractions and the diastole means the relaxation. So atrial systole means the atrial contraction time is 0.1 seconds. The atrial diastole means the atrial relaxation time is 0.7 seconds. So as usual, the ventricular systole and the ventricular diastole. So ventricular contraction 0.3 seconds and the ventricular relaxation 0.5 seconds. This is also 0.8 second total. See, these both also 0.8 seconds total. Okay, how means you people know both above atrium as well as ventricle the systole and the diastole takes place. So in the above atriums the systole and diastole takes place. So as I told before, atrial systole means, so atrial contraction 0.1 seconds time taken and atrial diastole 0.7 seconds time taken. So as same I told you before, so ventricular systole and the ventricular diastole 0.3 seconds and 0.5 seconds. Now we can start the ventricular systole and the ventricular systole and the ventricular diastole. Okay, now we can learn the events in the cardiac cycle. So ventricular systole and the ventricular diastole. So and ventricular systole and ventricular diastole. So in the ventricular systole there are two things. One is isotomic contraction, another one is so ejection period. Okay, in the ventricular diastole there are two things. One is protodiastole, another one is isotomic relaxation. Okay, now we can learn the isotomic contraction and the ejection period. First we should learn ventricular systole. So isotomic contraction, wait, I will draw some rough heart. Okay, this is a rough heart. Okay, so in the ventricular systole the isotomic contractions takes place. The main significance of isotomic contraction is, here it is a semilunar valve and here AV valve. Okay, the main significance of isotomic contraction is the opening of semilunar valve. So in the isotomic contraction the ventricular systole. So ventricular systole means, so there is a contraction of, systole means, as everybody knows, systole means contraction. So the contractions of ventricle. So in the isotomic contraction there is a closing of AV valve. AV valve will be closed. So that cause pressure inside the ventricle will be increases. So that's what the semilunar valve will be open. So in this condition the ejection takes place. So now we can take the particular isotomic contraction in the ventricular systole. Isotomic contractions. What happens in the isotomic contraction means the contraction of a semilunar valve. So here is a AV valve, here is a semilunar valve. So the ejection of blood from the left ventricle to the aorta through aorta, so ejection takes place. The ejection period, matlab the amount of blood which is been ejected from the ventricle to the aorta, which is called as ejection period. So isotomic contraction and ejection period will be clear. Now we can learn the ventricular diastole. In the ventricular diastole, same thing. Here now pressure increases and the ejection takes place. In the ventricular diastole, the protodiastole. The protodiastole means the closing of seminal valve. Now we can learn the ventricular diastole. Just wait, I will draw some rough heart. Okay. So this is heart. This is right atrium. This is left atrium. This is right ventricle. This is left ventricle. There are two things will happen, and I told you before. So in the ventricular diastole, the protodiastole and the isotomic relaxation will happen. The protodiastole means there is a closing of seminal valve. Seminal valve and this AV valve. After closing of these seminal valve, the AV valve will be open. Okay, because there is a relaxation happens and there is a pressure will be decreases. Okay, the protodiastole means the opening of close of seminal valve, the opening of AV valve. The main significance of isovolumic relaxation is the opening of the AV valve. Just keep in mind the main significance of isovolumic relaxation is the opening of AV valve. So that cause the filling of blood from the atrium to ventricle. Wait 1 minute. So there, after that these two things they happen, three things. One is rapid filling, one is slow filling, another one is atrial contraction. Okay, what is rapid filling? There are 70% of blood filled inside the ventricle. 70% of blood filled inside the ventricle from the atrium to ventricle. Slow filling means 20% of blood which has been filled from the atrium to ventricle. And the atrial contraction means the after 70 and plus after 20, the remaining is 10%. The 10% of blood which has been filled inside the left ventricle from atrium to. So in this atrial contraction, the contractions of atrium, this above left atrium contracts and the filling of blood from the atrium to ventricle, last 10%. Okay, I'll try once again. Just listen carefully. One is ventricular diastole, one is ventricular systole. So ventricular systole means the isotomic contractions and the ejection period. The isotomic contraction. In the isotomic contraction, there is a seminal valve will be open. Okay, because of the pressure increases in the left atrium due to closing of AV valve. Okay, after that, AV valve will be closed and the opening of a seminal valve that close the ejection of blood from left ventricle to the aorta. Okay, ejection period means the blood has been ejected from left ventricle to aorta. That is ejection period. So these both will be over. Now we can come to left ventricular diastole. Ventricular diastole means there are two things happen here: protodiastole and the isovolumic relaxation. In the protodiastole, there is a opening of seminal valve. Closing of seminal valve happens here, and opening of AV valve. The main significance of isovolumic relaxation is closing of seminal valve and the opening of AV valve open. So that cause filling of blood from atrium to ventricle. How will it will fill means there are three things. One is rapid filling, one is slow filling, another one is atrial contraction. The rapid filling means there is a 70% of blood which has been filled inside the ventricle from atrium. This is over. Now again slow filling. Slow filling means only 20% of blood which has been filled inside the ventricle through the atrium. After that, the third thing is atrial contractions. Only when the atrial will be contract, then only the blood has been filled inside the left ventricle. Okay, I hope you should understand these things. Guys, now we can learn the heart sounds. As everybody heard about the S1 and the S2, and some people don't know about the S3 and the S4. So today I can clear these things. So first of all, the first thing I heard, I'll try to tell the S1, how the S1 and the S2 and the S3 and the S4 will be heard, and what is the origin, the phases, and how it can be heard. Okay, first we can learn about the S1. Okay, the S1 is heard So I already drawn a rough heart structure. So these are the, as everybody know, these are the valves and these are the valves. This above are the right AV valve, this is left AV valve, this is pulmonary valve, this is aortic valve. Okay, so this one is tricuspid valve, because this one is mitral valve. Here arises the pulmonary artery, here arises the aortic artery, aorta. Okay, so this pulmonary artery known as P2 and the aorta is known as A2. So this is T1, this is A1. So tricuspid valve, mitral valve, so pulmonary valve and the aortic valve. So these things will closing and opening, then the heart sounds will be heard. So first we should learn the S1, how the S1 will be originated. The origin of the S1 is the closing of AV valve. These are the AV valves, matlab tricuspid valve and the mitral valve are called as the AV valves. These AV valves will closing and opening that cause the S1 sound. Okay, it is also called as lub, and the S2 is called as dub. This is lub, this is dub, the S1 and the S2. The S1 is originated by closing of these AV valves. One is tricuspid valve, one is a mitral valve. Okay, these two valves together called as S1 or lub. Okay, the S1 will be, how the S1 will be heard, the closing of AV valve, that will be hearding of S1, and this is also known as lub. Now we can learn the S2, how the S2 will be heard. The S2, I told you before, the closing of semilunar valve. This is the semilunar valve, so this will be closed. So the S2 sound will be heard when the closing of a semilunar valve. Okay, and it is called as dub. Okay, how these both S1 and the S2 will be heard? Through stethoscope. Okay, and S1 and the S2 will be over. Now we can learn the S3 and the S4. Once again I will tell the S1 and the S2 how will be heard. It will be heard through the stethoscope, and S1 is known as lub and the S2 is known as dub. The S1 is heard by closing of the AV valve. These valves will be closed, that then the S1 will be heard. What is S2? So S2 will be heard when the aortic valve or a semilunar valve will be closed. So the sounds will be heard only in the case of closing time. Okay, when the tricuspid and the mitral valve close, the S1 will be heard. When the pulmonary and the aortic valve, okay, this is aortic valve, this is pulmonary, these two will be closed, then the S2 will be heard. It is called as dub. This is lub, this is dub. Now we can learn the S3 and the S4. I told you people before the what is rapid filling. Okay, now we can learning about the S3. Okay, what is rapid filling? The filling of blood from the atrium to ventricle. So here this is atrium, this is ventricle. The amount of blood which has been filled inside the ventricle through the valves from atrium. So this rushing of blood from the atrium to ventricle, the rushing sound is called as S3. When the filling of blood from the atrium to ventricle, the sound will be heard, that the rushing sound is S3. Okay, and this is only heard through microphone. Very important thing, this the S3 sounds will never heard through stethoscope, only it is heard through microphone. Okay, one microphone device is there, that device helps to heard the S3 sound. Okay, once again I'll tell the S3 will be heard only in the case of the rushing of blood from the atrium to ventricle, that the rushing sound is called as the S3, and the S3 only heard through microphones, not through stethoscope. Now we can learn the S4. Okay, S1 is over and the S2 is over, S3 is over. Now the S4 sounds, how the S4 sounds will be heard. As everybody know the what is atrial systole. Okay, I write here, this is atrial systole. What is atrial systole means? As everybody know, systole means contraction. When the contraction of atrium, this is atrium, the atrium will contract, the sound will be heard. Okay, The contraction of atrium when the sound will be heard, that is S4. This S4 only heard through phono. Okay, I'll write here phono cardiogram. This is also on device. This S4 is heard through phonocardium, not through the stethoscope and the microphone. Okay, and the S4 sound will be heard by the contraction of the atrium. Okay, contraction of atrium matlab contraction of atrial muscles. When the muscles of the atrium will be contracted, the S1 sound will be heard. That is only through phonocardiogram. Okay, this is abnormal. The S4 sound will be always be abnormal. Sometimes the S3 will be normal because some athletes people's the left ventricular hypertrophy will be occur. That's what the S3 sounds will be heard, but the S4 sound will be always be abnormal. Okay, now I can tell all the sounds clearly. Please listen. The S1, S2, S3 and the S4. The S1 is heard only in the case of the closing of these above AV valves. The AV valves are the tricuspid one and the mitral one. This is heard through the stethoscope. The S1 is heard through stethoscope only, and this is called as the lub. The S1 is over. Now we can S2. The S2 is heard only in the case of the closing of semilunar valve. This is the semilunar valve. This is pulmonary artery and the aortic artery. The closing of these below pulmonary artery and the aortic artery, that will be heard S2. This S2 only heard through stethoscope. Okay, and this is also known as dub. The S1 is over and the S2 is over. Now we can learn the S3. Okay, S3 will be heard only in the case of the rushing of blood from atrium to ventricle. This rushing sound is S3 and it is only heard through microphones, not through stethoscope. Now we can learn the S4. S4 will be always be abnormal. The S4 heard through the contraction of atrial muscles. These above are the atriums. These muscles will be contracted. That sound called as the S4. The S4 will be heard through only phonocardiogram. Phonocardiogram is a machine or device which will helps to hear the S4 sound. This S4 sound is always be abnormal. The S3 sound somewhat normal in the case of athlete peoples, but the S4 is always be abnormal. I hope you guys understand the heart sounds. Guys, now we can learn the cardiac outputs. So before the cardiac output, I will clear the three terms. One is venous return, another one is stroke volume, another one is peripheral resistance. Okay, so first we can go through venous return. The venous return means the amount of blood which has been reaches to the right atrium from inferior vena cava to superior vena cava. Okay, now listen. So the amount of blood which has been reached or filled in the right atrium from the inferior vena cava and superior vena cava, so that is called as the venous return. The venous return means the total amount of blood which has been reached to right atrium from the inferior vena cava and the superior vena cava. Okay, I hope you clear this venous return. The next we can learn the stroke volume. Stroke volume means the amount of blood which has been ejected from the left ventricle in a single heartbeat. Okay, in a single heartbeat. Okay, this is the blood which has been ejected from the left ventricle to the aorta. This is pulmonary aortic valve. Okay, in single heartbeat. Now we can go through peripheral resistance. Peripheral resistance means by excluding the central resistance in the blood circulation, the resistance. First we should understand the resistance. Resistance means opposing or stop or pressurizing. So these three terms you understand. Now we can go through peripheral resistance. Peripheral resistance means opposing, stopping or the pressurizing. So okay, in this, in the blood circulation the opposing power or the mechanics which is offered in the blood circulation is known as peripheral resistance. Okay, now we can go through the main things in the cardiac output. One is end systolic volume, another one is end diastolic volume. Okay, now first we I hope you clear these venous return, stroke volume and the peripheral resistance. Now we can learn end diastolic volume and the end systolic volume. So end diastolic volume, as everybody know, the diastole means the relaxation. So the end diastolic volume means the amount of blood which has been filled inside the ventricle at the end of diastole. So diastole means the relaxation. At the completion of relaxation, whatever the amount of blood which has been filled in the ventricle from the venous return, okay, from the inferior vena cava and the superior vena cava, okay, the total amount of blood which has been filled inside the ventricle at the end of relaxation of ventricles, okay, it is called as the end diastolic volume. The normal amount of the end diastolic volume, the normal amount is 120 ml. Okay, the amount of blood which has been comes from the inferior vena cava and superior vena cava to the right atrium, this venous return comes to or filled inside the ventricle at the end of diastole, मीन्स द कॉन्ट्रैक्शन कंप्लीट होने के बाद. सो इसको कहते हैं एंड डायस्टोलिक वॉल्यूम. नाउ वी कैन गो थ्रू एंड सिस्टोलिक वॉल्यूम. एंड सिस्टोलिक वॉल्यूम मीन्स द अमाउंट ऑफ ब्लड विच हैज़ बीन रिटेन at the end of systole. Systole means contraction. So contraction, after the completion of contraction, the amount of blood which has been ejected, so the remaining amount of blood which is present inside the ventricle, this volume is known as end systolic volume. Okay, once again I will tell the end systolic volume, the amount of blood which has been retained or the present in the ventricle after the contraction of ventricle. So after contraction of ventricles, the amount has been ejected out, so the remaining amount of blood which is present in the ventricle, this volume of blood known as end systolic volume. So this ejection blood, whatever the amount which will comes out through aorta, that amount is 70 ml. I told you before, stroke volume. Okay, end systolic volume, the normal amount is 50 ml. Okay, end diastolic volume is over and the end systolic volume is over. Now we can go through cardiac output. So cardiac output means the amount of blood which has been ejected from the ventricle in 1 minute. I think you people confuse about the stroke volume and the cardiac output. Stroke volume means the amount of blood which has been ejected from the ventricle but in a single heartbeat. But the cardiac output means the amount of blood which has been ejected from the ventricle in 1 minute. Okay, the formula of the cardiac output is stroke volume into heart rate. So cardiac output is equals to stroke volume into heart rate. Stroke volume is 70 ml. Okay, heart rate is normally 72. So total is 5040 ml. So approx 5 liter. The total cardiac output. So total cardiac output is 5 liter. Everyone should remember. Now we should I'll clear the whole thing. So the amount of blood which has been comes in the right atrium in the right ventricle, so after completion of contractions or the end relaxation, so that is called as the end diastolic volume. So after this, the amount of blood which has been retained inside the ventricle at the completion of contraction or the systole. So at the end of systole, the amount of blood which has been retained inside the ventricle, that is called as the end systolic volume. So now I can clear this. Okay, this is heart, rough heart. So 120 ml of blood, the end diastolic volume is 120 ml. So end systolic volume is 50 ml. So the 120 ml of blood which has been comes in the ventricle, and after coming 120 ml, the ejection of blood, the stroke volume, everybody note the normal stroke volume is 70 ml. The 70 ml of blood which has been ejected, so the remaining amount, so 120 minus 70, the remaining amount of blood is 50 ml. So this is So end systolic volume. Okay, I hope you clear this. Once again I will tell. So end diastolic volume is 120 ml. The ejection or the stroke volume is 70 ml. So end diastolic volume minus 70 ml stroke volume, the total end systolic volume is 50 ml. मतलब 120 ml आया और 70 ml बाहर गया. So इधर ही बोल 120 ml will be came and 70 ml will be out. The remaining is 50 ml. 120 ml आया, 70 ml will be out and 50 ml. So this 50 ml is known as end systolic volume. End systolic volume. Okay. The formula of the cardiac output is stroke volume into heart rate. Now I can clear the whole thing. So first stroke volume, cardiac output. Okay. The stroke volume is equals to, so end diastolic volume minus end systolic volume. So cardiac output is equal to stroke volume into heart rate. Okay. So the normal end diastolic volume and end systolic volume, 120 ml end diastolic volume and end systolic volume is 50 ml. So and stroke volume is equal to 70 ml. Now, so the amount of blood which has been filled inside the ventricle after the completion of diastole, so that is called as end diastolic volume. So this amount is 120 ml, and the amount of blood which has been retained inside the ventricle after the systole, so this retaining amount is called as end systolic volume. This is normal amount 50 ml. Okay. How stroke volume will be calculated? The stroke volume is equal to end diastolic volume, and the end diastolic volume is 120 ml. So end systolic volume is equals to 50 ml. So the total is 70 ml. So stroke volume is 70 ml. Clear? Huh? So how the stroke volume is only 70 ml. The total amount of blood which is coming is 120 ml. So which is ejecting is 70 ml. So that's what the end systolic volume is 50 ml. So I hope you understand. So I can tell once again. So amount of blood is coming is 120 ml. Okay. The amount of blood which has been ejecting is 70 ml. That is stroke volume. So the remaining amount which is present inside the ventricle is 50 volume. This 50 volume is called as end systolic volume. Okay. The end systolic volume is 120 ml and end systolic volume is 50 ml, end diastolic volume is 120 ml, the stroke volume is 70 ml. So cardiac output is equal to heart rate into stroke volume. This is 70 ml and this is normally heart rate is 72. So total is 5040 ml. So approximately 5 liter. The total cardiac output is 5 liter. Okay. I hope you guys understand. So the factors affecting the cardiac output, now we are studying this. What and all the factors which will affect in the cardiac output? So cardiac output is directly proportional to the heart rate and the cardiac output is directly proportional to the venous return. As everybody know, I told you before, 5 to 6 minutes before, venous return means the amount of blood which has been reaching or filling inside the right atrium from the inferior vena cava and superior vena cava. Okay. And cardiac output is inversely proportional to the peripheral resistance. I told you people before the peripheral resistance also. So cardiac output means the amount of blood which has been ejecting in 1 minute. Okay, that is 5 liter. As the cardiac output will be increases, the peripheral resistance will be decreases. As the peripheral resistance will be increases, the cardiac output will be decreases. Vice versa. So these things you will remember. And okay, the next thing is cardiac index. Now we can learn the cardiac index. So one MCQ. So which of the following is the best indicator for the tissue perfusion? Tissue perfusion, that was cardiac index. How to calculate the cardiac index? Cardiac index is equals to cardiac output divided by body surface area. Okay, this is the formula. So as everybody know, cardiac output is equals to stroke volume into heart rate. So normal 5040 ml or 5 liter approximately. Now we can calculate the cardiac index. So cardiac output is 5040. Okay, just keep the same thing. So how to calculate the burn surface area? We don't know the burn surface area, sorry, body surface area. So body surface area is equals to, now we can calculate the body surface area. So body surface area is equals to under root of height in centimeter and weight in kg divided by 3600. This is the formula to calculate the body surface area. Now in under root of, this is body surface area, we should keep like this. So height, normal height is 170 we should put, and the weight is around 70 kg, as usual 3600. Okay, now we can calculate the body surface area. So the total amount is, the body surface area is 5040 is above same. So 170 into 70, it is around 1900. 1900 divided by 3600. So this value comes around 1.81 divided by 5040 as usual cardiac output. So the normal is around 2.76 liter per minute meter square. This is the unit, the normal cardiac index. So normal cardiac index is 2.5 to 4.0 liter per minute per meter square. This is the normal. Okay, now I can tell you the conditions where we can calculate the cardiac indexes. For example, one is hyperthyroidism, one is congestive heart failure. In hyperthyroidism and congestive heart failure, in congestive heart failure, the heart rate and the heart rate and the stroke volume will be decreases. In the hyperthyroidism, the heart rate and stroke volume will be increases. Lastly, we can calculate in hyperthyroidism patient. Here heart rate and stroke volume increases. Okay, the cardiac index is equals to the heart rate. We should keep around heart rate. Okay, the heart rate and stroke volume we should keep 100 and 100 in the body surface area. So the height is around normal 170. So in case of hyperthyroidism, as everybody know, the weight will be decreases. Okay, keep in mind, in hyperthyroidism the weight will be decreases. In hypothyroidism weight will be increases. Okay, so here weight will be decreases if we will put around 50. Okay, so this is same as usual 3600. So you people calculate around it will come around, this is normal, no? So 2.5 to 4.0 liter per minute per meter square. This is normal, but in case of hypothyroidism it will be increases. So this is a 4.0 is normal, it is comes around 6.5 liter per minute per meter square. So in case of congestive heart failure it comes around 1.76, or because 2.0 is normal, so below it 1.76 or 1.8. Just you should remember, in hyperthyroidism it will be increases. So in the congestive heart failure it will be decreases. So the normal amount is 2.5 to 4.0. Normal value is 2.5 to 4.0 liter per minute meter square. Okay, so in I will these all the notes I will keep, so take a screenshot if you need. Okay, now